Hold on, guys. There is an issue wherein I can see a broken screen. Just wait. Okay, so let's start now. Today we'll be doing the urinary system. In the respiratory system and digestive system, we saw that the body, these systems of our body, throw out certain waste materials. Urinary system has a similar function of throwing out most waste materials from the body. So whereas the respiratory system throws out carbon dioxide, the urinary system throws out excessive solutes from the body and excessive water. Okay. Also, along with throwing out these things, the urinary system has a few other functions. So overall, the urinary system, the science of urinary system is called nephrology, and the branch of medicine that deals with the male and female urinary systems and the male reproductive system is called urology. A person who studies this and specializes is called a urologist. Okay. The main organs of the urinary system are these two kidneys. Now here we have in the image here, this is the female and this is the male urinary system. We have the kidneys. These are the two kidneys. This is the ureter, which carries urine from the kidneys to the bladder. This is the bladder, and this is the urethra, which throws out urine. It's the same in a male, except that the path is not as straightforward as in a female. So if you see in a female, the path is straight. From the kidneys, the urine goes here. It is collected into the bladder and then thrown out through the urethra. Here, the urine comes up to this point. Then the ureter goes below the prostate. These are the prostate glands in males. And then it attaches itself to the urethra. So again, there is the sequence is the same: ureter, bladder, and urethra. Just the path is a little bit convoluted. So I'll show the path to you a little bit later. So what are the functions of the urinary system? The first function is the regulation of ions in the blood. So ions will be solutes like sodium, potassium, calcium, chloride, and phosphate. It regulates blood volume and blood pressure. So what the kidneys do is whatever water or fluids we take in through our mouth, the kidney processes everything and it adjusts the volume, the total volume of fluids in our body by returning this water either to the bloodstream again into the circulation or throwing it out via urine. The kidneys also help regulate blood pressure by secreting an enzyme called renin. It also adjusts the blood flow into and out of the kidneys and helps adjust the blood volume. The kidneys also regulate the pH of blood, that is either acid or base. The kidneys excrete a certain element called H plus in the urine. They also conserve blood carbonate ions, that is HCO3. So these both help regulate the pH of blood. They also produce two hormones, calcitriol, which is the active form of vitamin D and helps regulate the calcium, let's say homeostasis or balance in the body, and erythropoietin, which stimulates the production of red blood cells. The main function again is excretion of wastes. So it excretes water and it excretes ammonia, urea, bilirubin, creatinine, and uric acid. Now, there's this common condition that we see is urine stone. What happens here is if there is an excessive intake of these, let's say, ions or these materials through the food or through some other mechanism, And these are not thrown out by the body in adequate quantities. They collect. They mostly collect in the urinary system. So they may collect here. Once they collect here, either they break down and they are then thrown out little by little, or in small particles, they are thrown out through this route. They may get stuck here in the ureter. If they get stuck here, we have tremendous pain. So if anyone has experienced the pain from urinary stones, it's absolutely horrible. Yeah. One of us who's experienced urinary stones?
नहीं बाबा, नसीब से नहीं.
Very good. Drink a lot of water is, I would say, what you're doing so far is good.
सर आप म्यूट कीजिए ना, थोड़ा और डिस्टर्बेंस आ रहा
Okay.
Okay. So let's move on to the next image. We'll look at the kidney structure now. You see the new image?
Yes.
Okay. So kidneys are kidney bean shaped. You know a kidney bean, right? Rajma ke jaisa. So they are shaped that way. They are also reddish in color. There are two kidneys in our body, like we just saw in the earlier image, and they lie on two sides of our vertebral column between the back wall of the abdominal cavity and the peritoneum. The level is around the 11th and 12th thoracic ribs and the first three lumbar vertebrae. Now these ribs provide some sort of, let's say, protection for the upper part of the kidneys. In females, if we go to the earlier image, you see the earlier image?
Yes, Archana, we do.
Okay. So in females, one kidney is lower than the other. The right kidney is slightly lower than the left one because,
Men also it looks like that.
sorry, yeah, in men also looks like that. That's not it then. In they both lie here because on the right side we have the liver. This side we have the liver, which is occupying a lot of space on the left. So the right kidney is lower, the left kidney is a little bit above. Okay, so the difference lies somewhere else. An adult kidney is about the size of a fist or a bar of soap. If you see the next image, this is about the same size as our fist. In the center, this area is called the renal hilum, through which the ureter leaves the kidney and the renal artery and vein enter the kidney through this part. Okay. Now each kidney has a surrounding membrane called renal capsule. This part is the renal capsule, and it has a connective tissue sheath, that is a covering, which will help maintain the shape of the kidney and also serve as the barrier against any trauma. The kidney also has fatty tissue surrounding it, which will also help protect the kidney against trauma. Otherwise, if there was no fatty tissue, any trauma that happens to the abdomen or the back will directly affect the kidney. Okay. This tissue also anchors or holds the kidney in position at the posterior abdominal wall. Now, the kidney has two main regions, an outer one called the renal cortex and the inner one called the renal medulla. Within the medulla, there are several pyramids. Now, these are pyramids. You see these triangular shaped ones, cone shaped ones. These are the renal pyramids.
Can you show a pointer or something? I can't see.
Okay, hold on. See, these are the pyramids.
Okay.
Okay, you see the pointer now?
Yes.
The cortex. This is the, this is the
So
cortex.
the bigger triangles, the darker triangles.
The bigger ones, yes. These, yes. So this is what I'm talking about. These are the pyramids. You see this, right? Renal pyramid. It's marked, yeah. Okay, this is the renal column. Okay, then the kidney has this large funnel shaped area. This performs the work of this is like a funnel. This is called the renal pelvis. It's a cavity which is called renal pelvis. Now
Okay.
it has these bowl shaped structures. You see these bowl shaped structures?
Ah,
Yeah, so these are called calyces. The larger ones are called major calyces, the smaller ones are called minor calyces. So the urine flows from here into these calyces,
mm,
from here into the hilum, into the pelvis, and then it moves on ahead through the ureters. Okay. Now, this is the artery that provides or let's say supplies blood to the kidney.
mm.
About say 1200 milliliters of blood flows through the kidney every minute.
How much?
1200 ml.
Oh,
So 1 liter 200 ml of blood flows through the kidney every minute through the
okay.
both the right and the left. Okay. Now these renal arteries further branch out into smaller arterioles.
Mm,
The ones that take blood into the smaller sections of the kidney are called afferent arterioles. And they branch out. We saw yesterday how the bronchi branch out like a tree, right?
mm,
Now the renal arteries branch out in a similar manner into smaller and smaller arteries. And at the tail end, we get something that is called a glomerulus. Let me share the image of that one. Let me know when you can see the next image.
we can.
Okay. So this is a nephron. This entire structure is called a nephron. It is one unit of, let's say, the function of the kidney. So this is the smallest unit that carries out the function of preparing urine or the entire function of the urine. What happens here is the nephrons have multiple parts. If you see here, these blue, this is the artery. The red ones are the arteries which carry blood into this small portion. Now this portion is called a glomerulus. Okay, do you see it?
Yes.
Yes.
Yes, so it's been marked that way so that you're able to understand. Now there is a C-shaped structure.
Mm,
You see the C-shaped structure. This is called a glomerular capsule. This is
mm,
also called a Bowman's capsule, which surrounds the glomerulus.
yes.
Okay, so the artery flows here. It divides into multiple smaller arteries or arterioles.
Mm,
Or in the Bowman's capsule, there is an exchange of, let's say, material. So this could be blood, this could be solutes, this could be quite a few things. So there is an exchange of materials here. Most of this is absorbed into the water, into the urine that is formed, and it goes into this portion.
mm.
See the yellow portion here?
Yes.
This is now this structure is called convoluted because it is not straight, it is twisted. So this is the convoluted tubule. It's the tubule that carries urine further into the urinary system.
Okay.
From here, the urine that is now formed comes below.
Mm,
Okay. From here, now this part is called the loop of Henle. It's named because of the person who discovered this. The person was the last name of that person was Henle. So this is the descending loop of Henle. This is the ascending loop of Henle. So from here again into this entire portion, it continues absorbing solutes through the capillaries flowing around it.
mm,
It goes above from here.
mm.
And this portion now, a number of, let's say, tubules connect to this part. Now it is enlarged because a number of tubules are connecting here. This is the larger collecting duct now, which carries urine through a number of nephrons. Okay. Now this collecting duct will take down this urine into the minor calyx. From the calyx, it flows into the major calyx and then into the, what is the next part?
Where is the calyx? I can't see.
See, in the earlier image, the calyx was, if you can see the major calyx and minor calyx, you see the earlier
Yes,
image?
yes, yeah.
Renal
So
pelvis.
from there it will go to the
From the
Go-
calyx,
in the main ureter, no?
correct. From the calyces, it goes into the pelvis. From the pelvis, it goes into the ureter.
Oh, the pelvis is that structure.
Yes, so that is the collecting part of the kidney, the
Okay.
collecting cavity. Okay,
Got it.
so yeah, so the main function of a nephron is filtration, glomerular filtration. This is the first step of urine production. Then the next function is tubular resorption. What we just saw is that as urine flows through the tube, there are certain items that are resorbed, as in reabsorbed by the body. So about 99% of this water that the kidney filters is brought back into the body through resorption. There are so many solutes that are also brought back into the bloodstream. And then the last function is that the tubules secrete substances such as wastes, drugs, excessive ions from the blood at the peritubular capillaries. Peri means surrounding.
Hmm.
Peritubular means the capillaries that
Surrounding
surround the
the
tubule. Yes. So these are the ones that we saw. Here also, again, there is secretion of these waste materials from the capillaries into the tubules. Okay. So these are the three main functions of a tubule, or let's say a nephron. Now, if a patient has kidney problems, at a later stage, what happens is there is something called a glomerular filtration rate, which is affected. So
Yes.
what is a glomerular filtration rate? This is the filtrate that is formed in the kidneys every minute. Now, all that is absorbed here is called a filtrate. And what flows out through here will be the urine. So this filtrate that is formed every minute is called the glomerular filtration rate, or GFR. So it is about 105 ml per minute in females and 125 ml per minute in males.
Okay.
So this is the amount that our kidney processes every minute. So this is why we are told day before yesterday, we saw respiratory, that is how the lungs function. Before that, we saw how the liver functions. And now we are seeing how the kidney functions. The common phase here, or the common, let's say, precaution here we take is, if there is excessive load or excessive stress on any organ, what happens is that organ starts functioning less and less. Okay. So if our kidney is affected, the GFR may be too high. If the GFR is too high, then the substances that the body needs are also filtered out through the urine, because the kidney cannot handle so much of, let's say, fluid at a time. Okay. Which is why there is a person may experience fatigue, because the ions slowly start flowing out through the urine. And if there is less of sodium, potassium, let's say chlorides in the system, we experience fatigue, yes, and imbalance in our solutes. Likewise, if the GFR is too low, all the filtrate is reabsorbed through the body, and waste products are not thrown out. So for people who are drinking too less of water or too huge quantities of water, both is not good. Okay. So typically about 99% of this water that the kidney absorbs and processes, it is reabsorbed. only 1% of this water is thrown out as urine.
Okay.
One of the things that is thrown out through urine is glucose. Now, we must have heard of people secreting glucose out of their urine. So, when blood concentration of glucose or any solute for that matter increases above the normal level, the kidney will throw out more of it because the convoluted tubules for these yellow parts are not able to work fast enough to resolve everything. Okay. So much of the glucose then remains in the urine. And now this condition is called glycosuria because there is glucose in the urine.
Yes.
One of the most common causes of this is diabetes mellitus, in which the blood glucose level is increased and it increases so far above normal that glucose is then secreted out through the urine. Similarly, what happens here, because now these solutes, for example, glucose is thrown out through the urine, water always follows solutes. So more water is also thrown out in the urine. That is why people with diabetes mellitus have more urine production or what we call polyuria. Okay, one of the conditions is a person with diabetes gets up so many times at night for urination,
Even
right?
during the day, no?
Even during the day, but mostly this is observable at night because when night sleep is affected, people realize that something is happening.
Oh, gosh.
Yeah. Now, let's go on to the components of urine. We will see this in short. Okay, we are not going into the details. You can see the table here.
Yes.
Okay. So, about 1 to 2 liters of urine is excreted throughout the day in 24 hours. Most of it is water and some of it is these substances. So there is water, chloride, sodium, bicarbonate ions, glucose, urea, potassium, uric acid, and creatinine.
Okay.
Now there's a certain quantity. Urine filters this much, it reabsorbs this much, and it excretes this much. Now, if more than this quantity is excreted, then we have a problem. And it indicates certain conditions. So more glucose we just saw is diabetes mellitus. Okay.
Could it also be just the glomerular filtration is not right, happening not correctly?
No, see, the problem here is that the glomerular filtration rate to be affected takes a long time.
Okay.
So by the time glomerular filtration rate is affected, the body has already developed and progressed the disease. Okay. So any disease for that matter, for us to realize and come to that stage that where the disease is diagnosed, the process has already started in the body. Also, kidneys are very resilient organs. So, for example, if one kidney is affected and it starts not functioning well, or even if it stops functioning, the other kidney picks up the slack. And that one kidney may cover up for almost 80% of the load of both the kidneys together. So, for someone to realize that they have the symptoms and their kidneys are affected, their kidneys have been affected long back and the function has reduced to such an extent that their body is not able to function anymore. You remember we had a case long back, Devil, wherein you know the girl, I'm not naming her, but she had an infection which passed on from her bladder into the kidneys.
Correct.
And that took a long time for resolution.
Yes.
Because by then there's a lot of progress happening in the progress or rather regress happening in the kidneys.
Okay. So if even if infections are left untreated, they can affect kidney function.
Yes, because the infection travels up.
Okay.
If it is a kidney infection, it may be, let's say, it may travel down or let's say progress to other areas. But even an infection like urinary tract infection, if you ignore it for long enough, it will travel up. Okay. Now let's move on to how the urine is transported, stored, and eliminated from the kidneys. So the kidneys produce urine, which drains into the minor calyces, the major calyces, it moves on to the urinary, let's say renal pelvis. From there on, it goes into the ureters and then into the urinary bladder. Okay, so this is the usual path. Now these are the ureters. There are two ureters that join from the kidney to the urinary bladder. Now, if you see, this is the bladder, and the ureters will join the bladder or enter the bladder at a lower portion of the bladder. They will not attach themselves here, they'll attach themselves here. Okay, this helps when the bladder is full. This will help compress the mouth of the ureter and it will stop the flow from kidney to the bladder. Okay, so this must be a common occurrence. When you feel that your bladder is full, but you cannot go and relieve yourself, then the flow from here to here stops. But the kidney is continuously functioning. What happens is then this portion is affected a little bit. So if you don't pee for a long time, your bladder is definitely full and this portion is full. So you start feeling a slight pressure in your abdomen, in the lower part of your abdomen. Yeah, everyone one must have experienced this at some or the other point in their life. But usually what happens is once the mouth of the ureter is constricted or compressed, then the urine does not flow out. It stops here. Now, when the bladder is full, let's say if there is about 200 to 400 ml of urine in the bladder, it is full. That is when we get a sensation that now we should urinate. Okay. The urinary bladder is a hollow organ, and when it is almost empty, it's usually not always empty, but when it is almost empty, let me share an image here. So this is the urinary bladder. This is where the ureters join the bladder. Now this is shown as a circular organ because potentially it is full. Otherwise, it is like a deflated balloon. Okay. It slightly stretches itself and becomes spherical when it is filled. And once it is more full, what happens is it rises up into the abdomen. Now, this part is usually in the pelvis. When it is full, it rises up into the abdomen. Now, there is a physiological process that happens here. If your urinary bladder is too full, if you press on your abdomen, you feel a sensation that you must pee right away, correct? In females, what happens is the uterus is above the bladder, above and behind. So in pregnant females, the uterus presses on the bladder, which is why pregnant females have more, let's say they pee more
More
because
often.
their bladder, you were saying
They pee
something?
more often because of the bladder pressure, not because more urine is being produced.
No, 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 no. The uterus presses on the bladder, which is why you get that sensation often.
Okay.
So the amount of urine may stay the same, but there is external pressure on it. It's the same as if your bladder is full and you press on your stomach from outside, you will want to pee, right?
Correct.
It's similar. So there is external pressure on it. This is the urethra. It is the last portion of the urinary bladder or urinary system. It connects the urinary bladder to the outside of the body here. So this is the orifice. Orifice means opening. This is the orifice which takes urine out of the body. Okay. Now at the orifice, there are two sphincters, the internal urethral sphincter and the external urethral sphincter. The external urethral sphincter is under voluntary control, like we saw with the two sphincters at our anus in the digestive system. Okay. Now, if we see the male urinary system, the male urinary system also has connection to the prostate gland. Now, what happens here is the males also throw out semen or ejaculate semen and the bladder or the urethra functions as the external, let's say, connection to the ureters as well. Okay, so males throw out semen as well as urine through the penis.
Can you repeat what you said because we lost the voice?
Okay, so in males, the urethra functions also to ejaculate sperm or semen. The correct word is semen here. And it also expels or throws out urine. You got this part?
Can you hear?
Yes.
Okay. Okay. So the urinary bladder, say about at a time between 200 to 400 ml of urine is once collected in the urinary bladder. It gives a sensation of that sensation that you want to pee. Now this sensation makes you want to pee, and once you pee, this process or the act of urination or this act of urination through the urethra is called micturition.
Micturition, yes.
Yeah, micturition. So if you still don't pee, what happens is, as an adult, you're able to control the external urethral sphincter. But if you see in a child, if they are not allowed to pee, for example, in a class, if the teacher doesn't allow them to pee, what happens is they urinate themselves.
Yes.
Yeah. So this is because in children, the reflex or the control is not as much has been formed in the adults.
Adults, okay.
Okay. Even in adults, we would usually advise that once you get this micturition reflex, you should go and pee out. If this happens,
We should not hold back.
you should not hold urine, because if you're into the habit of holding, there are other problems that can arise from that.
Okay.
Okay. Now, this lack of control over micturition also occurs in old age. It occurs in childhood as well as in old age. If it happens in adulthood, it is called urinary incontinence, which is a condition. So urinary incontinence can happen in children, in adults, but it is problematic when it happens in say mid-age, where a person is not old. At that time, they are expected to have complete control over their urination. But if they don't, then there is an issue there. Okay. Some people have stress urinary incontinence for some reason, so that when they cough, sneeze, laugh, exercise, or lift heavy weights, a small amount of urine is expelled out. Okay. Now, this happens, or this could happen during pregnancy. This could also happen after multiple deliveries in females. What happens there is, when there are multiple deliveries, after multiple deliveries, the muscles in that area relax a bit. They are not as tight as earlier, which is why they may have incontinence. It can also happen in smokers. So smokers smokers are at twice the risk of developing urinary incontinence than non-smokers. Yep. What happens? How does old age affect the urinary system? So with old age, there is a decreased blood flow to the kidneys. So the kidneys have less blood flow. They filter less blood at a time. Again, the filtration rate reduces by 50% in people between, it starts reducing and it reduces by about 50% between 40 to 70 years of age.
Okay.
Older people have more kidney diseases. They may have more kidney stones. They also have reduced thirst because of age, which is why when old people drink less water, they are at risk of more infections, more urinary tract infections, kidney infections, as well as conditions like peeing at night, which is called nocturia, or polyuria, which means peeing throughout, more peeing throughout. Then there is dysuria, which is painful urination, and hematuria, or blood in the urine. Okay. Now let's look at some common conditions of the kidneys or the urinary system. The first one is glomerulonephritis. We just learned what a glomerulus is. So glomeritis always means inflammation. So could someone tell me what does glomerulonephritis mean?
Archana, should I refrain from answering?
Sorry?
Should I refrain from answering?
Yes, please. Can someone else answer?
Rajiv, come on. Shanmugh, Valli.
It is urinary tract infection.
Not just, it is specific to these two things. So glomerulus,
Glomerulonephritis.
yeah. We just saw what a glomerulus is, right?
Yeah.
So it is inflammation of the glomerulus.
Yeah.
Okay, inflammation of the kidneys, specifically the glomerulus. So one of the most common causes of glomerulonephritis is an allergic reaction to toxins because of streptococcal infection. Okay, now streptococcal infection is just one of the reasons for glomerulonephritis. There could be other reasons as well. Then one of the other conditions is renal failure, which is decrease or stopping of glomerular filtration. In acute renal failure, the kidneys abruptly stop working. And in chronic renal failure, it is usually progressive and irreversible. Okay.
So acute
Now,
is reversible, right?
acute is kind of reversible because it has a cause that you can treat and it is not as progressed. When it comes to chronic renal failure, it has already affected the kidneys to such an extent that it cannot be reversed. Okay. So in this condition, once it progresses from there, from chronic renal failure, the next stage is called end stage renal failure, in which about 90% of the kidney function is lost. Okay. The GFR or the glomerular filtration rate is only about 10 to 15% of the normal. There is less urine produced and more waste material goes back into the bloodstream. So people with end-stage renal failure will require dialysis therapy. And once they progress from there or once they go into the dialysis stage, they are candidates for renal transplant.
I want to share something here.
Yes, please.
I had a case in Mumbai.
Yes,
So she was suffering from renal failure for last 15 years. And since last 5 years, she has not peed. Okay.
Oh.
All was through dialysis. She never peed. I started to work on her. Her creatine level was 9.
9, yes.
And then when I started to work on her, I brought the creatine level to 3.
Okay.
उसका मेरे पास पूरा documented वो था, लेकिन मालूम नहीं मैंने कहाँ पर रख दिया. So I brought that creatine level to 3, and for the first time in 5 years, she peed.
I remember she called, she was so elated about it.
Yeah.
Mm.
Okay, so
Nice.
that is the one case what, but then later on, there were many things happened, and because of which she stopped the treatment. And then last year she died. Okay.
Oh.
Yeah.
Ravi,
Okay.
please share such cases. This is very interesting.
Yes. She was so thrilled that she actually called to say, "Ke, Arey,
Yeah.
So I remember we had the recording for the longest time.
That's awesome.
Yes.
Once usually patients reach that stage, it's very difficult to get back to normal. So from 9 to 3 is a huge progress. Creatinine levels of 9
And
to 3.
her rate of dialysis also had to be reduced. No, she didn't have to go 4 times a week. There was so much improvement that earlier, before Ravi started treating her, they used to take her in a stretcher for dialysis because she was completely bedridden.
Oh.
And then when once the treatment started and her creat levels started falling, she used to climb down the stairs on her own. She used to not even be able to, turn in the bed. Mother used to turn her. And then once the treatment started, not only did she start turning on her own, she started sitting up and they took her in a wheelchair. After that, she did not need the wheelchair. She started getting up and going on her own into the taxi. She would sit in the taxi on her own. She would climb down the stairs and she would sit in the taxi on her own. She started going to the washroom on her own. She started all her activities of daily living, jo hum kehte hain ADLs. She started doing them independently.
And when she showed the result from 3 labs, different labs, her what क्या बोलते हैं उसको dialysis करने वाला बंदा, he just took away the result from her and he never returned them to her. उसका जो डायलिसिस का सेंटर था उसको वापस नहीं किया उसने रिजल्ट. हमने 2 डिफरेंट लैब से फिर एक बार उसके जो वो जो बंदा था जो डायलिसिस was the person who was doing dialysis, in his lab we did the test, and then from 2 different labs we again cross checked. It was 3 only.
That's awesome.
Okay.
This is kind of unheard of. Maybe we could document such cases, Ravi, for all our students. I mean, this is the first batch.
Now I don't have any records for her.
No, we don't need all the records. We could just write down what you've just shared.
Yeah, we can.
Okay.
Okay.
So we'll move on. There are a couple of terminologies that we would like to learn. So you just heard about dialysis. Can someone tell me what is dialysis?
It's like a ventilator for the kidneys. In layman's language, it performs the function of the kidneys. They are basically like the glomerular function of the kidneys is performed by the dialysis machine.
Yes. So it performs the same tasks as the kidney does. It cleanses the blood so that all the excessive, let's say, solutes are removed from the blood. Excessive electrolytes, waste materials, and fluid. Everything is removed, and the clean blood is sent back to the patient inside the patient's bloodstream. Okay. Dysuria is painful urination. Enuresis is involuntary voiding of urine or involuntary urination during adulthood. So once a patient or a person has achieved voluntary control of urine, let's say they grow up, if they involuntarily void, it is called enuresis. So so there's a condition called nocturnal enuresis, which means when children pee in bed after a certain age. Okay. Then kidney stones, so we all know the kidney stone can be in the kidneys, it can be the bladder. I have seen huge kidney stones. So I'm just sharing something with you. I'm not sharing a kidney stone, just the size of a kidney stone that I've seen. So I've seen a kidney stone that affected this entire portion. So most of the kidney was affected.
Are you sharing any screen?
Yes, I'm sharing. 1 second. Okay, now you can see it. So this entire portion was filled with the kidney stone, and the calyces here in this region, they were all affected. So this entire portion was obstructed. You see this? Now, looking at logical progression, how do you expect the kidney will function? What will happen?
It cannot filter anymore, no?
Yeah, so this entire portion is now affected. It's closed up. There's no urine coming out from this portion because this area is closed up. What happens is this area, because it is obstructed here in this portion, although the area is functional for a while, it will not allow the urine to come out through here. So there is stress on these portions of the kidney. Okay, when there is stress on these portions of the kidney, this will eventually stop functioning and the rest of the kidney will have to take up the balance of the function. Okay. Now, if a part of this stone will break off, it will come out through here. If it is a huge, let's say, chunk of that kidney stone, it will get lodged somewhere here and there will be pain when the ureter throws it out or tries to rather throw it out. Okay. Then urinary retention is a failure to completely or normally void urine. It can be caused due to an obstruction in the urethra. So, if the urethra is obstructed completely, what happens is that urine is not flowing out. It will be retained in the kidney or in this portion till here wherever. So there could be then dilation of the urethra. If there is an obstruction here, what will happen?
Where the bladder will get filled up but not void.
Yes, the bladder will get filled up. It cannot void, and the urine will flow back through these ureters.
Flow back.
There's a backflow. So in the long term also there are issues, but usually what happens is this happens primarily in males at an advanced age if their prostate obstructs the flow of urine. Okay, now let me share an image with the male urinary system. Now, as we saw in the male urinary system, the flow of urine is slight different because the ureters. Oh, hold on. Okay, let me know once you see it.
Yes, can see it. Can you expand it a little?
Yeah. Okay, so this is the prostate. Urine comes out through the bladder through this portion and then it moves on. The urethra is a little bit longer than in the females. So then it moves out through the urethra. Now, if you see at an advanced stage, what happens is the prostate enlarges. Once it enlarges, it presses on the urethra and the urinary flow is obstructed. Because of this, men who have a prostate condition, when the prostate is enlarged, they have their urinary flow is affected. In that, urine रुक के होता है, थोड़ा थोड़ा होता है, थोड़ी थोड़ी देर में होता है, which is why they are always having that sensation of micturition. Okay. Okay. So I think we are done for today. Urinary system is done.
Yeah. We can
We
conclude the class.
Yes, so we'll meet back tomorrow for the next system.
Which is the next system?
Probably cardiovascular, but let's see. If we can fit in within one session, we'll get that tomorrow.
Okay.
Okay.
Great.
Chalo, so have a good day,
See you.
everyone.
Bye.
Thank you.
Bye.
Thank you very much.
Interesting session today.
Yes.